afternoon. We'll continue with our regional checks on the COVID-19 situation. Let's head to the eastern region where we're learning of new cases from a school. A private school in Akosombo in the Sojaman district of the eastern region, we're told, have recorded 40 cases out of the 19. Out of a total of 500 samples taken from the school, 40 students tested positive and have been asked to self-isolate. Health officials say all the students are asymptomatic and are responding to treatment. My colleague Maxwell Kudeko has been finding out more. He's joining me on the phone. Hello, Maxwell.
Hi, Gifty.
Maxwell, what do we know about this school?
Well, the school is a private school in the Akosombo in the Sojaman district of the eastern region. Officials do not want to disclose the name of the school, but we know that it's a private school, a big school in Akosombo. Now, one student tested positive last week, and then health officials needed to do a contact tracing. So they sampled about 500 students, and then they picked their samples for test. The test turned out to be that 40 out of the 500 students have tested positive to COVID-19. We are told that almost all the students are asymptomatic, so it's very difficult to identify some of these COVID symptoms from them. Director of Ghana Health Service, the Eastern Region, Dr. Winfred Ofosu, tells me that all the 40 who tested positive have been asked to self-isolate, and then they are responding to treatment accordingly. The other students have also been asked to adhere to the safety protocols religiously. So statistics tells us that the Sojaman district is the second most affected district in the eastern region when it comes to the COVID-19 infection. They have 70 cases. So for out of the 70 cases, 40 are coming from this private school that was tested last week. The New Javin South, that is Kofodia, tops the league of COVID district in the eastern region. So this is all that we know about the infection in the said private school in Akosombo in the Sojaman district.
Well, you've also been looking at compliance when it comes to the safety protocols. You visited the Agatha market. Tell us what you found.
Well, a couple of the traders were seen in nose masks. A few of them also had their masks beneath their chest. They have resolved, mostly the traders, to somehow adhere to the protocols. But people who have trooped to the market to do business, most of them are not in nose masks. Let's listen to some of the traders and a few people we met at Agatha market.
Coming from, and we really need to take care of ourselves by adhering to the COVID protocols. Those who are found flouting the COVID protocols should be severely dealt with. Observing the COVID protocols would help us all.
Observing the COVID protocols is a daunting task, but we need to abide by them. As you can see, we are observing the social distancing protocol and wearing our face masks.
We are strictly abiding by the protocols, and we turn away those who come to buy without face masks, because we have to follow the directives by the government by wearing our face masks and washing our hands regularly.
Well, Maxwell, looks like mixed reactions there, but at least for the majority of those that you spoke to, they seem to be very mindful of it. What are authorities saying or doing about the situation in your region? Hello, Maxwell? Okay, it looks like I've lost Maxwell there. But let's talk to Dr. Winfred Ofosu. He's a Regional Director of Health Services for the Eastern Region. Doc, thank you very much. Can you start by giving us an update on the COVID situation in your region? My colleague has given us a few figures, but do confirm for us. Hello?
Hello.
Yes, Doc, thank you very much. I was asking you to take us through the statistics, your COVID statistics. Well, my colleague has just told us a few things, but do confirm for us the figures. How many cases have you recorded so far?
Yes, so far for the 2021, we've recorded 322 cases as at 2nd February. And the total active cases that we have now is 158. Okay. We have also recorded 9 deaths. So those are the best statistics for Eastern region.
For now. So this afternoon, we're learning that a school in the region has recorded 40 cases. What can you tell us about that?
Yes, there's a school in Akosombo who has recorded a number of cases. They've recorded 42 cases, but there are still some results which are pending. But most of them are asymptomatic, and currently they are at isolation in the school. They are all in good condition. 42
cases, you said?
Yes.
How did we find this out? Was there some kind of mass testing in the area or
yes,
was this?
It was a mass testing that was done. One person had symptoms and was tested and was positive. So they decided to screen the entire school, and they tested over 500 students. So that's how come we had that number. And most of them didn't have any symptoms. They were asymptomatic. But because the screening was done, they were picked out. That's why we have such
Which school is this?
I have to try and get it for you.
Well, I mean, if there's a reason why authorities do not want to mention the name of the school, because we've been trying to get this. If there's a reason, we can take an explanation, I think.
No, I have to get the name of the school for you. I mean, it's in the Akosombo district.
So are the students there, are they...
the students are in the school.
Are they teenagers? Are they teenagers or are they children?
Come again.
Are they teenagers or are they children?
Children, as to which age are you referring to?
Yes, which was the age range of the students we are talking about here?
I can't get you exactly what you want.
I want to know the category of people who were tested, out of which 40 are positive. Are they younger people? As in, what's the age range?
No, they are students.
Okay, I get that. Very soon we'll figure that out. But in terms of compliance, my colleague has been to the market. Some good, some good work being done there. Some of them seem to understand the exigencies of the time. What is your plan in terms of communicating the seriousness of this outbreak to the people, and is it working?
Yes, we'll continue to talk about the need to comply with the protocols. Wearing face masks once you are entering the public or you are in a space where there are other people, and then as much as possible ensuring social distance. Yes, speaking about largely a lot of people are still not strictly adhering to this. And that's the challenge, because we know even as the new variants come on into the stream, these are much more infectious. So people are more likely to get infected once they are exposed. So the need to adhere strictly to the protocols is even much more important than before.
I'm asking whether this message is being sent across to the people, and how.
How we are sending the message?
Yes, I mean, what is the...
Yes, we continue to do education in the health facilities and also in the communities.
Okay, because I've just spoken to I've just spoken to a pediatrician who was commenting on what we are beginning to realize is more children, testing, or more children being tested positive or having tested positive for COVID-19. So one of the points he made was how information seems to have been centralized, but the need for that information to be broken down and taken to the people for they themselves to spread it among themselves. Is that a strategy you are considering in your region?
Yeah, the community, we give the information to the community, so I don't know why he's saying that the information is centralized.
No, it's not for the Western region. It's not for the Eastern region. He was talking generally.
We met with the district directors and medical groups, and we discussed all this things. The importance of making sure that our people in all communities receive the message, so they adhere to the protocols.
Let's talk about your case. Okay, please go ahead.
So the information is not centralized in Sekufroba, but is gone in all the districts. And we have staff visiting the districts, conducting public health activities. And part of it is to carry education, risk communication on COVID activities. So the information is not centralized. Okay, let's look at your case management so we can wrap up, Doc. How are you managing the cases? In Accra, here in Accra, for example, we're told that there is a lot of pressure on the health management facilities. We're told that our facilities are full. What is the story in the Eastern region? How are you managing these cases? Most of our cases are on home management. We have 5 cases which are on admission. So as at now, we do not have much pressure as far as managing cases in the health facility is concerned.
That sounds good. What is the story about PPEs for health workers as well?
The health workers, yes, quite a number are also part of the statistics I gave out. And we are encouraging them. We know that it's not very comfortable wearing the protective gear throughout when you are working. But it's important for us to adhere to it so that we can be safe. So a number of them have gotten infected. So they are currently under quarantine.
How many of them, sir?
They are doing well.
How many of your staff have tested positive, sir?
Then I need to refer. I don't have that figure here.
All right, no problem, sir. Thank you very much for your time this afternoon.
Okay.
And that's the Eastern Region Director of Health, Eastern Regional Director of Health Services, Dr. Winfred Ofosu there. So confirmed 42 cases recorded today in the Eastern region in a school. We're yet to know which school that is. He also says that some of the health personnel have been infected and they are in quarantine. He's unable to give us a number right now, but they have only 5 cases being managed at a facility. All the rest are being managed at home.